guys. Thanks for being here with me tonight. It is World Autism Day, so very symbolic meaning in posting this video for me today. Just to kick this video off, I want to introduce you to Sanaya. She is a precious little girl who passed away just last week. Directly after receiving a few of her childhood vaccines. She was leaving the doctor's office, had a grand mal seizure, just like what my son experienced. Very tragically, did not survive. And, you won't hear stories about this in mainstream media, but they're pretty common. And this, again, only happened this past week. And so I feel like I want to share her story with all of you.
From me, bro. That's messed up.
This child was given a toxic slew of the most dangerous vaccinations at age 1 when she already had a cold and she had constipation. Did at any point the medical professionals in that clinic that gave those vaccinations to your beautiful daughter, did they ever tell you that about any of these side effects, or there could be anything that could happen from taking these shots?
No, all she said was that my baby might get a little fever. And we went to go leave, and not even 3 minutes after we driving, someone was like, turn around and look at Sanaya. And I turned around and looked at my baby, and her eyes was rolling in the back of her head, and she was just like going like this and foaming out the mouth. We got to the hospital. This was St. Vincent. What is it? St. Vincent's Hospital in Pennsylvania. When we got there, they rushed her to trauma. In the time and the frame of me bringing her in there, my baby ended up having about 4 more seizures after that. So they ended up putting her to sleep, and the nurse came running to me and was like, I'm sorry, but your daughter, she's very sick. She's very sick. She was like, right now she's in cardiac arrest. Like they trying to resuscitate, like they bring her back. And we went down there, and my baby was like, she wasn't responding, like her heart wasn't responding.
They was giving her CPR for like 40 minutes. They was trying to bring her back alive for 40 minutes. Then next time they said, they was like,
we're gonna check her pulse, check for a pulse one more time. And if we don't have a pulse anywhere, she's gone. And they checked, and she didn't have that pulse. And they said my baby was gone.
You don't expect to go to a hospital, to a doctor, and for them to not tell you everything. Like, you're expecting for them to let you know, like, if something could have possibly, even if it's a possibility that something could happen, inform the parents and get them that choice, that to make that decision on whether they still want to try to go forward with whatever it is, or if they don't.
Don't let your kids take the vaccination shots.
Ask questions.
Ask questions before anything they give you, anything, ask questions, because promise you they're not going to tell you everything. And even if they do, still do your research on your own, because they can tell you one thing and it won't be true. Do your research on your own before y'all say y'all want to let y'all kids.
I've never seen a woman on a mission until you've seen a mother determined to save her child. There's no match for a mother's love. She read, she researched, she investigated, while I tried to come to terms with the idea that I might never be able to shoot hoops with my son. I know there are things that my son wants to say to me. And as he gets older, I can look into his eyes, and I can see the frustration and the confusion. There's a little boy inside of him somewhere, but it's like he's lost. And this is really what it's like. It's like being in the mall with your child, and you look down and you discover they're not there anymore. It's that sickening feeling you get in the pit of your stomach. Excuse me. Except every once in a while, you catch a glimpse of the real boy. You know, the way his eyes light up when you bring the Christmas tree home. Or the way he smiles when he jumps into the pool, or the way he sits perfectly still and enraptured when we go to see the symphony. He loves music, he loves animals, he loves trains, he loves books, swings, ice cream, even his family, of course. But he can't tell me his favorite color, or how his day at school was, or What hurts when he falls off the swing set?
Liam was a normally developing baby until June 27, 1997, when he received his MMR and Hib vaccines. He was constantly taking off his shoes. He screamed if we dressed or undressed him. He would stare for hours in front of a television and wouldn't move if you blocked the
same day, Jacob and Jesse both received their first DPT, polio, and Hib vaccination. From that day on, Jacob was constantly coming down with one ear, respiratory, or sinus infection after another.
On August 9th, 1990, Jackson would begin a journey into silence, bewilderment, and a medical enigma. That was the day he received his MMR immunization. He would not sleep that night. In the days that followed, he would develop unexplained rashes and horrible constipation and diarrhea. Over the next weeks, he'd slip away, unable to listen or speak. He retreated into what we now know as autism.
And somewhere along the way, he developed chronic, non-specific diarrhea, sometimes 8 to 10 times a day, and still suffers from that 3 years later.
Not express even the most simplest needs or wants. He could not ask for juice or something
Living with these children can be hell. They can destroy your entire home. You can't keep anything nice around. They will ruin your rugs. They will jump off the furniture. They will move the furniture around the room, push it over, and they do nothing with any intention of no malice whatsoever.
When Jacob is overloaded from sounds, colors, or lights, we cannot go anywhere. Autism does not only isolate the individual that it affects, it isolates the entire family.
I live just 3 miles from Duke University Medical Center. Yet for one of the most effective treatments for Jackson's gastrointestinal problems, I drive 12 hours for a procedure that takes 5 minutes.
Integration therapy, vision therapy, speech therapy, occupational therapy, sensory integration therapy. We had CAT scans and allergy testing and stool analysis and urine analysis and all kinds of blood analysis.
Jacob's countenance left when he was 16 months old. The light behind his eyes was replaced with a blank, lost, bewildered stare.
How do I put a cost on not sleeping for 6 years? How do I put a cost on attention not paid to my daughters because I'm seeing to the needs of my son? How do I put a cost on locking every door and window at all times for fear of him wandering out of the house?
I need someone to explain to me why it's acceptable to have products on the market that expose my son to 37.5 micrograms of mercury in one day at a time when he should not have been exposed to more than 0.59 micrograms of mercury given his body weight.
I should have taken the time to find out what his risk of contracting hepatitis B at only 1 month old was. I didn't do that. I should have known back then what I do today. I did not. I trusted his pediatrician. I trusted the CDC. I was persuaded to believe that I was doing the best thing I could do to protect my child.
Statistics can no longer be ignored. Thousands of parents who claim their children were developing normally until the MMR vaccine should no longer be ignored. We all can't be wrong.
Personally, if I could strike the belief that my son's autism sprang from a routine childhood vaccination that I held him down on the table for and had to go back to the Russian roulette of genetics, I would take it in a heartbeat. Because the pain knowing that I inadvertently caused him harm due to the blind trust in the medical community or a matter of inconvenience of yet another office visit taking time away from my job is nearly unbearable.
How you doing? We have triplets, 2 boys and a girl, Richie, Robbie, and Claire. Every day in our life was a party. Every single day they were smiling and laughing and looking at each other, engaging in each other. On June 25th, 2007, we brought them in for the pneumococcal shot. My daughter still has the mark on her leg from the shot. She was the first one to get it, and she screamed and never really stopped screaming after that. But we continued. We didn't know. We did the boys as well. By noon, Claire shut completely off. It was as if she was blind and deaf, and all she did at that moment was stare at the ceiling fan. So that was at noon. We had the shot at 10 a.m. 2 o'clock, we watched Richie shut off. They lost all their reflexes. I'm an educational audiologist.
This groundbreaking charger is taking the tech world by storm. It can charge your phone from 0 to 100%.
I actually did the test for the stapedial reflex, which is a little muscle in the middle ear, just to see if a muscle they can't control was still working, and it didn't. The stapedial reflex dampens sound, so your ears don't hurt from a really loud sound, and both of them had no stapedial reflex. They stopped blinking, stopped yawning, stopped coughing, stopped sneezing.
The worst is when we saw the final one shut down. We were told it was genetic. And then we were told by geneticists that there's no possible way 3 children was shut off on the same day. So we had severe autism spectrum disorder for all 3 kids entering kindergarten. We have spent hundreds of thousands of dollars trying to recover them. The only person that we got back is Robbie, the one that was last to shut off. Richie can only say single, maybe 2 words together. Claire is still completely nonverbal, not potty trained, and Robbie is approaching grade level, but severe OCD.
What do you do? What's your...
Property management. Let me tell you what a day in our life is. So you got, say, a 6 or 7 or 8-year-old child who's not potty trained, and at 2 or 3 or 4 o'clock in the morning they fill their diaper. Well, you assume that's pretty uncomfortable, so they take it off. Pretty soon it's all over them. It's all over the bed. In short order, it's all over me. It's all over her. I'm snapping at her. She's snapping at me. We're both snapping at the kid, who is the only innocent party in the whole scenario. And the one thing that's conspicuously absent from that scenario is anybody who told you that shot was safe. They're all asleep in their bed. They haven't got a problem in the world.
Tonight, exclusive Jim Carrey and Jenny McCarthy, partners in life and partners in the search for answers to autism.
Yesterday, the world was World Autism Awareness Day. You both must be encouraged by all that's happened in this subject since you literally started it.
Yeah, you know, we've come a long way within the community. When I first had Evan diagnosed with autism, there wasn't much of anything. I had to find out about biomedical treatment on the internet after I typed in autism on Google. And out 3 years later now, there's 3 books and many thousands of children getting better because of biomedical treatment.
Jenny brought so much focus to this problem. And kind of that's why I'm here, is I want to bring as much focus as we can to this problem.
You married autism. Or, well, you're not married, so you live with autism.
When I invited Jenny into my life, I invited Evan into my life. And when I first met Evan, it was like he was on another planet. I wasn't in the room. There was no eye contact. There was no response to dialogue. There was no affection. And over time, I witnessed Jenny pull Evan through the window of unconsciousness and isolation into our world, where he is now a fully functioning person who can communicate, who can connect, and this is through biomedical treatments, GFCF diet, and the therapies that she's talking about. So I believe that autism, in my heart, is preventable
and treatable.
Fully functional. He's
completely recovered, Larry, completely recovered. And he's not the only one. There are thousands in this community that are getting better.
Why did you go so public? I mean, you had an autistic child. He got better. So why are you here?
I could have, you know, hid and not said anything, and Evan would have blended into society. I made a pact with God, though. The day Evan became diagnosed with autism, I said, if you show me the way, God, and show me how to heal my boy, I will continue to teach the world how I did it. And within 1 year of that kind of conversation with God, Evan was undiagnosed from autism.
But it's still shocking to see how many people are ignoring this information.
The American Academy of Pediatrics, I begged and have sat down with and said, why are you not sitting down with our doctors and our scientists who are treating and recovering children with autism? And they refuse to this day to sit down.
I think if there was any possibility that a child was being helped, that someone would listen, someone would take a look. And the fact is, they're not even considering the information. They're not only not considering, they're discouraging it.
But you've had a major effect. Big story in the LA Times last week. Number of kids not being vaccinated in public schools in Los Angeles. However, at the same time, a doctor friend told me today, mumps are up and measles are up.
We're not saying don't vaccinate. That's the thing we want to get really clear right now with. This is the thing. There's a lot of misdirection going on. We keep hearing, we hear the Campbell Browns and people like this that are saying, you know, you can't not vaccinate. No one has ever suggested not vaccinate.
Go back to the 1989 schedule when shots were only 10 and the MMR was on that list. I don't know what happened in 1990. There was no plague that was killing children that we had to triple the amount of vaccines.
What happened after 1989?
And why did they
triple? It warranted 26 more vaccines.
Agreed.
Are all of them absolutely necessary?
Because they want to make money.
Of course. Back in 1989, the shot schedule was 10 shots given.
10 shots given.
When I was a kid, what do we get, 3?
It's twice as many as anywhere else in 30 countries in the Western world. But we give twice as many shots as any of those countries. Why is that?
If it's vaccination and you're not against vaccination, Well, what are you against? Don't vaccinate for this, but vaccinate for that?
Yes.
I think we have to choose which
Well,
ones
how
are
do I know
absolutely
which
necessary.
one?
You should educate yourself. We want to empower parents to educate themselves. Do we need to have the chickenpox? Do we need the hepatitis B shot on the second day of life?
I don't think we can afford to assume that the people who are charged with our public health any longer have our best interests at heart all the time. Parents have to make their own decisions, educated decisions. They have to look at the information.
Space out the vaccines. Delay them till after 1. Clean out the toxins that are in them. We don't need that many.
When the other doctors are here, and they will be on the other side in a while after you leave.
Grab them and stab them, you mean?
That was one.
This is my nickname.
Well, what will they say? Why would a doctor not want to know more about something that could save a life or prevent a disease? I don't understand.
The AAP is financed by the drug companies. Medical schools are financed by the drug companies. This is a huge business. Vaccines are the largest growing division of the pharmaceutical industry. $13 billion.
They control medical schools. I mean, these doctors are not learning about prevention or vitamins or diet.
What we're asking is for them to take a loss for the good of our children. That's a tough sell in a board.
To my organization, Generation Rescue, and say to me, listen, I was approached by a government agency to be hired. And what I do is I set up PR campaigns to go against the narrative. And it's going to be called You're Anti-Vaccine, that they're going to come after you and hard. And I said, well, how are they going to do that when I've clearly said in every interview I'm not anti-vaccine? Like, I'm just telling the story of my child, of what happened and how I'm getting him better. And they said, doesn't matter. They're going to come after you with everything they've got, and they've the media on their side. And I didn't believe them. I was like, there's no way, because I preface it in my book. I've prefaced it everywhere. You know,
you didn't even get scared.
I didn't get scared.
I would have a heart attack.
It didn't really hurt me until it started taking jobs away from me, because I was a single mother still trying to heal my son, pay for speech therapy.
It's the aluminum that we really know crosses the blood-brain barrier, and that's still in vaccines today. And anyway, we'll get into blood-brain barrier if you want to. That's a whole other story. But yeah, so mercury, obviously, it can get into the brain. It's found in the brain. It can get into your adrenals and your other glands and important areas of your body. And even the thing is that even at such low levels can cause problems. It's no neurotoxin. Has no place for circulating or being deposited in the human body in any form.
But isn't it fascinating that they've done such a good job promoting this that people are going to get outraged at what you're saying? They've done such a good job.
Welcome to my life.
And you've got a lot of courage. And I want to commend you for that, because writing that book and being here talking about it takes a lot of courage. And it's from regular people who want to believe the vaccine. They're scarier than anybody. The people that are just rabid vaxxers. And they stand for science, like they're the warriors for science, and they get very aggressive about it. And they don't even want to breach the subject. They don't even want to look at it. Because the more you look at it, if you're a logical, rational person without like a deep-seated ideology attached to vaccines, and you just looked at the reality of it, you just go, what is this?
Yeah.
Like, how did you trick people into injecting, how many a year now for kids? What is it?
In the 70s. I believe we're in the 70s.
That's insane.
Yeah.
And then you want to demonize anybody who says anything about vaccine side effects. You are the craziest of kooks. They come down you with the hardest publicity campaign. It's so transparent. You see it coming a mile away, and you're still shocked by how blatant it is. And no one wants to look at the actual issue itself. And no one wants to say, like, well, is she right? If you read your book, you go, is she right? Mm-hmm. Well, if you're right, and I think you're right, like, we've been lied to. And we've been tricked into thinking that this is all settled science. And that's what's infuriating. It's not that it's anti-science. It's like, this is not science. What you guys are doing is not science. You've subverted, you've perverted that notion. And you've done it in an amazing way. I mean, hats off to you. What they've done in terms of like brainwashing people to believe that all this is it's not just necessary, but it saved millions of lives, and anybody that is against it in any way, shape, or form is a quack, and you should be deplatformed and never talked about again. And polite public society and cocktail parties, you'll be shunned.
Well, this is the moment that we all dreamed about. This is why we have been working together to have informed consent. It's really simple. How safe are these vaccines? Why can't we find a single decent study that's ever looked at them? Why have you never compared the health of unvaccinated children to completely vaccinated children? Why has the entire vaccine schedule, which is now nearly 80 vaccines given by the time you're 18, all of them together, there's no study that has ever shown how these vaccines all work synergistically together. I've told you that there's no double-blind placebo study trial that's ever done prior to licensure of the childhood vaccines. These are things that need to change. We're going to talk a lot about this. We're going to talk about food dyes and chemicals. What do you do if your regulatory agencies are putting things on the market without a safety test? When does the safety test happen? After everyone's already taken it? After we're living in a toxic soup of all the other chemicals you put on? Today I showed you sometimes I get fighting mad. There are certain things that push you to a place that you cannot describe. And one of them is, as a reporter, as a journalist that has interviewed people my whole life, the year that I spent traveling this nation with the film Vaxxed that I made, and the thousands of parents, those of you out there in our audience that so bravely came forward to tell your story about your child regressing into autism immediately after vaccinations. Many of you told your story and put it online. Vax.com carries over 1,000 of these stories where people can see with their own eyes what can happen with a vaccination. And I talked about this abomination of science and one of the greatest tragedies of all times. You know, doctors and scientists will say to us, well, you know, sure, there's no one size fits all and there's no perfect product and there are some injuries. That's the casualty that we accept to achieve herd immunity. Well, to hear that statement and recognize that these parents that told their true eyewitness accounts, they weren't taken care of. They were never handed millions of dollars that it's going to cost to raise their child. And even worse, as they spoke up and spoke to their doctors, they were made fun of. They were ridiculed for having recognized what had happened to their children and told that maybe they need a therapist to talk to, that somehow they were delusional. Because of this statement by the CDC, every doctor felt that it was okay to make fun of these parents and push aside the experience that they were having every day of their lives. I can't tell you how important it was from the moment that I started this mission, the moment I decided to leave my career in television and make the film Vaxxed, that has changed this discussion around the world. When I started our nonprofit, the Informed Consent Action Network, and I sat down with Aaron Siri, we said this statement is one of the most important things, will be a milestone that will decide the end of this lie. We will not sleep until this statement is removed from the CDC's website. Last night, as we were preparing for what might be a legal battle with Forbes that is lying about our white papers and the connections between vaccines and autism, we went to go get this link so that we could share it. And guess what we found? It's gone. It's gone. The statement that vaccines do not cause autism is over. The CDC will no longer ever stand by that statement because of the lawsuits and the pressure brought by the Informed Consent Action Network. I cannot understate, I think, how important this is for all of you parents out there that have suffered through this lie, had to face it, face your children, do the brave work you do to stand for your children and spend all of that money that you have spent to try and heal your children, some more successful than others, to have people insult you, the Sanjay Guptas, and every, single doctor that steps on a television or stands in a white smock and told you the science is settled, vaccines do not cause autism. Those days are officially now over. They are over. That paradigm is over. We have achieved what was one of the most important steps towards the reality that vaccines can and do injure some children. Now, below, there is still the line that was once below this: vaccines do not cause autism, that's now just been replaced by autism and vaccines. They say there is no link between vaccines and autism. For those of you that are not aware of how science works, that statement was always there, but this statement simply means we have not done the science to recognize whether there's a link. We are hiding, we're running from the science. We've proved that in the Plotkin depositions. And it will go on to say later on this page, well, we still believe vaccine ingredients can cause autism. I want to let you know that this is only the beginning. We've taken down one of the greatest lies the pharmaceutical industry and its proxy, the CDC, has been stating for all of the years that I've been a part of this investigation. But we are not stopping here. We will not stop till the studies are actually done. The vaccinated versus unvaccinated studies that will not leave us in limbo wondering whether there's a link. We will continue to provide all of the evidence that we have throughout the years of aluminum and all the different things that are leading to cytokine storms, brain inflammation, which truly is the injury, and leads to the resulting behavior known as autism or other neurological disorders. Today, we have celebrated multiple wins. We have a way forward. And though the world around us seems extremely tumultuous, I want to let you know that I will never give up. For every parent of an autistic child out there, know from the bottom of my heart, I know our movement is growing because of all of the people that are now questioning the safety of vaccines. You made that possible by telling your story, but we will never leave you behind. We have gone from...
Both Terry and his older brother Michael have been diagnosed with high-functioning autism.
No, darling, we're not making it. No, we're not making it dark, Michael. No, wait.
Their parents, Isabel and Ian Thomas, haven't had a good sleep in a long time. It's like this day and night.
Sit down to eat, Michael.
But again, their parents say, as toddlers, they were developing normally.
Terry was walking when he was 10 months old, and Michael was talking fluently at the age of 2.
What happened to your boys?
We lost them. We lost our boys, and we were given 2 boys, the same outward body, but inside different. And that was after we had them vaccinated.
Teddy! You realise it's almost 10 o'clock at night?
As the boys' condition worsened, their parents noticed something else unusual. Both Terry and Michael were suffering bouts of excruciating bowel pain.
So Porter is the second of my 4 kids, born totally healthy and thriving. And when he was 4 months old, he went in for the typical well baby checkup. Had a spate of vaccines, a whole number of them, and one of them that he received was the old whole cell pertussis vaccine that had a live virus. What subsequently happened was we went through the day, he went to bed, and we were awoken at about 11 o'clock at night by the worst high-pitched scream I've ever heard. And it was one of those experiences where you've never heard this sound before and you know something is just horribly wrong. So we ran down and I picked him up and his head flopped to the side and he was boiling hot. Turned out he had 105 fever. And I called the nurse's line saying, something's wrong, I think he's having a reaction to the shots. And she said, oh, that's common, don't worry. And I said, but he won't wake up. And she said, get to the hospital right now. And we gunned it into the hospital and got in there and kind of handed off this floppy limp baby to the doctor, and he proceeded to go into a grand mal seizure. And we then realized, I didn't, the doctors realized he was in something called the post-ictal phase, which is how a person is after a seizure. They're unconscious and out of it. He went into this grand mal seizure, and the seizure went on for 2 hours. I didn't know a seizure could go on 2 hours. And at some point, we had nearly every doctor working in there trying to figure out how to get him to stop seizing, and they're giving him more and more Valium. And finally, the doctor turned to me and he said, "Don't worry, we'll stop the seizure. It's just that I'm going to have to sedate him to the point he's going to stop breathing." And that was when I knew, boy, the world has changed. And they intubated him, hauled him off, and that started this whole trajectory that, you know, ended with where he is today, a 20-year-old young man who wears diapers and a seizure helmet and can't talk and has intractable seizures.
And what's his diagnosis?
His diagnosis is brain injury from the pertussis vaccine. He also has DSM or psychiatric diagnoses. He's autistic. He has mental retardation. You probably could go into a lot of different things he has, but those are the two big ones.
So autistic.
Definitely studied, right? They're definitely studied. They definitely study every claimed injury. Every time you say it can cause this or that, they say, rest assured, vaccines don't cause it. Don't worry, there's over 100 serious injury vaccines. And what is the one, the claim that they say they have studied most thoroughly and have assured you the vaccines don't cause it? They say vaccines do not cause? Autism. Okay. I don't want to make it about autism, but we're going to use autism as the example, okay, of an injury claimed from a vaccine, and let's see what studies they've done. Because remember, that's the injury they say. We studied this thing through hundreds, millions, billions there are more studies than people on the planet. We've studied this thing. Don't worry, right? They assure you. So if they really haven't done that for autism, what are the chances they've done it for all the other serious harms for vaccines that parents complain routinely to us at the firm and otherwise in literature, for whatever reason, don't get media attention, even though some of them are far more common than autism in terms of their complaints from vaccines. Okay, so let's take a look at that. This is the CDC website, and this is what people say about vaccines and autism.
We're not sure as a scientific community what causes autism, but we know that vaccines do not.
Vaccines are really the one thing we have looked at as causing autism.
Yeah, I agree with we know that vaccines don't cause autism. The science is clear.
Vaccines don't cause autism.
I do not deny in any way that we need to do more about autism, but it has nothing to do with vaccines.
Let me be clear. Vaccines do not cause autism.
Vaccines don't cause autism.
Absolutely sure.
Absolutely sure.
Okay, there you go. Case closed. Well, I don't know. What does informed consent mean? Oh, it means maybe we look at the data, right? And not just take their word for it. So let's do that. Okay. Despite the fact that public health authorities will repeatedly and with their billion-dollar media machine tell you vaccines don't cause autism, to this day, based on the studies surveying parents of children with autistic kids, 40 to 70% of them will tell you that they believe that their child's autism is caused by one or more vaccines. Sometimes you can't unlearn what you've seen, I guess. And what vaccines do they typically blame? All the ones that just became red. Let's do that one more time. These are the ones listed in those studies. Hep B, DTaP, Hib, pneumococcal, that's the Pfizer one, IPV, and MMR. Now, all the other ones are given in the first 6 months of life, each, 3 times each. So we've got Hep B, again, DTaP, Hib, PCV13, Prevnar 13, and IPV. 5 different shots given 3 times each. That's 15 doses of vaccine that parents are saying they believe caused their child's autism. And then at 1 year of life or later, they get an MMR vaccine, okay? So if you want to say vaccines don't cause autism, you would say you would have to show that those vaccines don't cause autism, right? Presumably they have studies that show that. And by the way, this idea, I know a lot of people focus on the MMR vaccine and they say, oh, it's MMR. Just to show you that it's always been the other vaccines. This is the 1986 Act, right? We talked about it earlier, National Child Act 1986. Look at this. In the 1986 Act, It listed 11 of the most common claimed injuries from vaccines at the time. And it told federal health authorities, do a survey review to see whether the vaccines are causing these issues. And what vaccine did they ask them to do with regards to autism? Was it MMR? No. It was pertussis vaccine. Pertussis vaccine. Highly effective vaccine. Secretary of Health and Human Services shall complete a review of all relevant medical and scientific information of the nature, circumstances, and extent of the relationship, if any, between vaccines containing pertussis and the following illnesses and conditions: autism. 1986, Dr. Wakefield, Andrew Wakefield, did not publish a study until the late 90s, over a decade later. Parents were complaining about pertussis vaccine causing autism a decade prior. Nothing to do with MMR. Okay, great. Good news. Congress said to our health authorities, please study this. Our health authorities went and commissioned the Institute of Medicine. The Institute of Medicine then did a review of all the scientific literature. And what did they find? No evidence bearing on causal relationship. What does that mean? No category of evidence was found being on a judgment about causation. All categories of evidence left blank in Table 1.1. Let me translate that. They could not find one study, one way or another. Nothing. They didn't find any studies. Not a study showing that it does cause autism, not a study showing it doesn't cause autism, no studies either epidemiologically or mechanistically or in any other category. There was literally zero. It was actually the only condition where they could find no evidence one way or another. All the other ones, they could find something out there that either tilted it towards it doesn't cause it, it does cause it. They say they don't know. Well, okay.
Military gadgets are transforming people's conditions and endurance, and here's how. This is what happens when you breathe.
Great, you think at some point they would actually, they would study it. That was the former head, I'll skip ahead. That's the former head of the NIH who says, we haven't studied this issue of whether vaccines cause autism. We got to study this thing. And she says, I'm a little concerned because it looks like the health authorities are scared to do it because if they find, even if some kids have autism from vaccines, people will freak out and nobody will vaccinate. That's a terrible reason not to do it. I mean, we have all kinds of drugs that have problems with some people and we still, okay. Let's skip ahead to 2012. Again, the CDC and another federal health agency commissioned the Institute of Medicine yet again. And this time, they again asked them to look at whether pertussis, as well as tetanus and diphtheria vaccines, can cause autism. Why? Because this study looked at the 100 and something most commonly claimed injuries from vaccines. Here we are, over 3 decades after the 1986 acts. And pertussis, containing tetanus and diphtheria now as well, causing autism is still one of the most commonly claimed injuries from, that they cause autism is one of the most commonly claimed injuries. Well, again, they conducted a review of all the scientific literature, and they said the evidence is inadequate to accept or reject a causal relationship between diphtheria toxoid, tetanus toxoid, or acellular pertussis vaccines and autism. By the way, so if you don't know whether it causes autism, how are they saying vaccines don't cause autism? Aren't those in conflict? Yeah. Only if you're logical. Now, if you look up, they did find one study. One. You can see right there, Geyer and Geyer. This was not considered in the weight of evidence because it provided data from a passive surveillance system and lacked an unvaccinated comparison population. So they threw it out. Do you know what data it relied upon? VAERS. And you know what it found? It found a correlation between DTaP and autism. So the only study they found, only study they could find, showed a correlation in DTaP and autism, but they threw it out because it was based on VAERS data.
It is my great honor to use the Stanley Plotkin gavel to open this meeting.
Our good friend and colleague, Dr. Stan Plotkin.
Dr. Plotkin, virtually every country in the world is affected by his vaccines.
He was involved in pivotal trials on anthrax, oral polio, rabies vaccine,
rubella vaccine, the rotavirus vaccine, rabies.
He has earned the Distinguished Physician Award of the Pediatric Infectious Disease Society, the Finland Award of the National Foundation for Infectious Diseases, the Hilleman Award of the American Society for Microbiology, the French Legion of Honor, and the Bruce Medal in Preventive Medicine.
He's a member of the Institute of Medicine and the French Academy of Medicine.
One of the very special things about him is the global impact that he's had, not just from the products, but from his book,
He developed the standard textbook for vaccines in 1988.
Bill Gates calls his book a Bible for vaccinologists.
I hope you all have indeed have read the book, and I hope it's more accurate than the Bible.
He trained just a generation of scientists, including myself, to think like he thinks.
This is an excerpt from the IOM's report, right?
Yes.
Okay. Can you read the causality conclusion with regard to whether DTaP and Tdap cause autism?
The evidence is inadequate to accept or reject a causal relationship between diphtheria toxoid, tetanus toxoid, or acellular pertussis containing vaccine and autism.
If you don't know whether DTaP or Tdap cause autism, shouldn't you wait until you do know, until you have the science to support it, to then say that vaccines do not cause autism?
Do I wait? No, I do not wait, because I have to take into account the health of the child.
And so for that reason, you're okay with telling the parent that DTaP, Tdap does not cause autism, even though the science isn't there yet to support that claim?
Absolutely.
What do we call that? Okay, so Dr. Plotkin says what he says. That's in 2018. So then in 2019, on behalf of ICANN, the Informed Consent Action Network, we submitted a few FOIA requests. We said, hey, CDC, can you kindly provide us, quote, all studies relied upon by CDC to claim that DTaP vaccines does not cause autism. We made the same request for the Hep B vaccine, Prevnar, Hib, IPV. Those 5 shots given 3 times each in the first 6 months of life, as well as the studies that show the cumulative doses of those vaccines do not cause autism. Surely they have one study. One study. Well, after they wouldn't provide us any studies, we sued them in federal court. And this is a final stipulation in which the CDC finally listed 20 studies. You can see them numbered 1 through 20. They say these are the 20 studies they rely upon to say that vaccines don't cause autism, that all those vaccines given in the first 6 months do not cause autism. When they made that list, I got the stipulation from the Department of Justice with the DOJ attorney that we're working with. And I remember having an exchange with them, and I said, I read the studies. None of them involve the vaccines I'm asking you about. I said, and in fact, only one of them discusses a single vaccine at issue in this case. And that's the 2011 IOM report we just looked at, which is one on the list here, for DTaP. And I said, it only lists one study that shows vaccines do cause autism. They threw it out. I said, are you sure the CDC wants to provide me a list of 20 studies that don't actually support in any way the 5 vaccines that ICANN is asking you to provide studies to say that vaccines don't cause autism? As you can see, the Department of Justice signed the stipulation right here, right there. See it? Right there. United States Attorney, signed by Zachary Bannon, Assistant U.S. Attorney. On behalf of the CDC, I signed it on behalf of ICANN. It was entered as an order of the court. That's a federal judge, an Article 3 judge. And this is it. This is a binding order of a federal court in which you have 20 studies. 18 of them involve thimerosal, which is not an ingredient in any of the vaccines we asked about, or MMR, not a vaccine we asked about. One involved antigens, not vaccine, and that study itself says it can't tell you whether vaccines cause autism or not because it didn't look at that. It just looks at antigen exposure. And then one involving MMR, thimerosal, and DTaP, and that's the 2012 IOM report you just saw me ask Dr. Stanley Plotkin about. So 0 involved vaccines, the requested, except for the one DTaP, which found one study of the correlation. I'll show you one more video, and then you'll hear me say what I know you all are going to expect me to say about post-licensure safety. This is an opportunity to depose Dr. Catherine Edwards. You see the 4 authors of Plotkin. This is the medical textbook on vaccines. She's the third listed, and at this point, she's probably one of the top 3 vaccinologists in the country, if not the top 2, effectively. Maybe Paul Offit, her, something like that. Let's see what she has to say. In a case involving vaccines and autism, I just want to be clear, I didn't surprise her, I didn't trick her in this deposition. I don't have magical powers. I just asked questions, that's all I did. In a case, again, about vaccines and autism.
According to your profile, you have done most of the pivotal trials relied upon to license many of the vaccines, correct, on the market?
Yes, sir.
Okay. So you're highly experienced at conducting clinical trials, correct?
I'm highly experienced conducting clinical trials.
Okay. And you're familiar with many of the clinical trials that relied upon to license many of the vaccines currently on the market, correct?
I am.
In your opinion, did the clinical trials relied upon to license the vaccines that Yates received, many of which are still on the market today, were they designed to rule out that the vaccine causes autism?
No. You've badgered me into answering the question the way you want me to, but I think that that's probably the answer.
Is that your accurate and truthful testimony?
Yes.
In the expert disclosures for this case, it asserts that, among other things, you will testify that, quote, the issue of whether vaccines cause autism has been thoroughly researched and rejected, end quote. It's your testimony that MMR vaccine cannot cause autism.
That's correct.
It's your testimony that Hep B vaccine cannot cause autism.
That's correct.
It's your testimony that IPOL cannot cause autism.
Yes.
It's your testimony that HIV vaccine cannot cause autism.
Yes.
It's your testimony that varicella vaccine cannot cause autism.
Yes.
It's your testimony that Prevnar vaccine cannot cause autism.
Yes.
And it's your testimony that DTaP vaccine cannot cause autism.
Yes.
And do you have a study that supports that DTaP doesn't cause autism?
I do not have a study that DTaP causes autism, so I don't have either.
Do you have any study one way or another of whether IPOL causes autism?
No, I do not, sir.
Do you have any study one way or another of whether NDRX-B causes autism?
I do not have any evidence that it causes autism, nor that it does not.
And what about Hib titers vaccine? Any evidence one way or another of whether it causes autism?
No.
And what about Prevnar vaccine? Any evidence one way or another?
No, sir. No, sir.
And how about varicella vaccine? Let me just finish. Are there any studies one way or another that support whether it does or doesn't cause autism?
Part of MMR, but not as varicella by itself. No, sir. No studies that say it does, or no studies that say it doesn't.
Right. There have been studies that have found an association between hepatitis B vaccine and autism, correct?
Not studies that I feel are credible.
Okay. Which study are you referring to when you say that?
Well, why don't you show me the study, and then I'll see whether I agree with it.
So hold on a second. I didn't do it. She did it, honestly. I just asked questions. So there's what the public health authorities tell you when they're putting stuff on websites and they're on CNN, or they're publishing stuff. And then there's what they say when they're under oath. And they're very different. They tell you vaccines do not cause autism. You don't even need to. You're a parent. It's not your job to prove the vaccines are not safe. It's their job to show you that it is safe. They have not done that. And if they haven't done it for autism, the thing that they say they've studied more than anything, what do you think they've done for the other 100 serious adverse events that are listed on the package inserts that the manufacturers say they have a causal reason to believe might be related. They don't list autism, by the way, but they do list over 100 other serious conditions. And if they haven't done it for autism, the thing that they say they've studied more than anything, what do you think they've done for the other 100 serious adverse events that are listed on the package inserts that the manufacturers say they have a causal reason to believe might be related? They don't list autism, by the way, but they do list over 100 other serious conditions. Just to put this in perspective, these are all the vaccines in the childhood vaccine schedule. Those are the 2 vaccines they say they've studied, that they actually have any studies for it, MMR. Okay? These are the ingredients, just a partial list. That's the ingredient they say they've studied, not even in most vaccines, and not in the ones in the first 6 months that we asked about. I'd like to show you that it can be humorous, obviously, but for the families who have children in this situation, it's anything but humorous. And that provides that the package inserts for vaccines should only include those where there's some basis to believe there's a causal relationship. And there are over 100 serious adverse events listed by pharma because they had a basis to believe they are a causal relationship. And these are some of the same issues we get calls at our firm for all the time, but there's not much we can do for any of those families in terms of the Vaccine Injury Compensation Program, which is the only place you can seek compensation. You can sue for vaccine injuries. The only place you can sue is you sue the Secretary of the Department of Health and Human Services. That is the head of the federal government's health department, in which CDC, FDA, NIH is located. They're statutorily required to fight any claim of vaccine injury. And you don't get a constitutional judge, Article 3 judge from the Constitution, you get a special master. And you don't get any discovery as of right. You can't just go depose the pharma companies or get documents. Extremely limited program. And we don't have clinical trial data, and we don't have post-licensure data. And we have to fight against the Department of Justice. So very little we can often do, unfortunately, for many families who call us about many of those issues. But they are real. Those kids are real. Those harms are real. They don't go away. But autism, I think, really does have a good reflection. It's the best example I think I can provide you of when we look at the post-marketing literature for other issues, how vacuous it is. Nobody has an incentive to do it, not the pharma companies and not the federal health authorities. If they do a study, it shows a harm, we'll use it against them in vaccine court. And they also take their duty to promote vaccines very seriously, and it has entirely overtaken any safety duty that they have. Pharma companies also have an annual kitty of billions of dollars. Just like car companies promote their products, they promote their products. How? Money flowing to medical journals, medical associations, schools, public relations firms, and so forth. A $1 billion machine every year promotes vaccines by the pharma company and the industry. Gosh. Wow, did that just go for an hour and a half? Okay, in about an hour. All right. So I'll go through the rest of it a little bit quicker. Eliminating market forces is a big deal. That literally is how you assure product safety. All the products you have in your society around you every day, they're safer because the companies who make them don't want to lose money. That's it. That's really that is the most important impetus. Market forces, and then I put regulators. You see a little small thing right there? I did that on purpose. Regulators, not as important. Market forces, very important. Guaranteed market plus no liability has resulted from that, 1986, 2023. That's the childhood vaccine schedule. That's what we've gone through. I've interlaced it over here so you can kind of see really visually the difference. Clinical trials. Why are clinical trials critical? Because after a vaccine is licensed, you can't do a clinical trial. They say it's unethical. But a clinical trial is what you need to actually prove causation between a claimed injury and the product, which is why doing a good, robust clinical trial is so important. And what's a good clinical trial? Proper control, enough people in it so it's properly powered, and reviewing safety for long enough. Those 3 features. That's what makes a good clinical trial. Here's the impact on eliminating market forces, okay? These are the top 5 selling drugs by Pfizer according to some website. Okay, when you look at these 5 drugs, 4 of them are drugs, 1 of them is a vaccine. Enbrel, Eliquis, Lyrica, and Lipitor are all drugs. What did they have as a control in their clinical trial? Placebo. How long was safety review? 6 years, 7 years, 2 years, 5 years. Why? Because they want to know the safety. If Pfizer puts these products on the market and they cause harm, what's going to happen? They're going to get sued. They're going to have to pay damages, and they don't want that. They want to make money. Which one is different than the others? Pfizer, right? The Prevnar 13 vaccine given at 2, 4, and 6 months of age. Half a year, licensed against PCV 7. And that vaccine was licensed, by the way, in a clinical trial that compared it to another experimental vaccine. Can't make this stuff up. You can watch one of my other presentations to see that whole skit. Here are the vaccines in the first 6 months of life. Hepatitis B, safety review period, 5 days, IPV. You can see the difference between years versus days or weeks. Prevnar, 6 months, and what the control was. Not a single one actually had a placebo. And that's true, by the way, for virtually every single vaccine on the childhood schedule. None had a placebo control group. Typically, all the clinical trials were days or weeks of safety review. Some had 6 months, but without a proper control. What are you comparing it to? And they're often very underpowered. That is the effect. That is the real-world impact of eliminating the market forces. You disincentivize proper clinical trials, which are critical for assuring safety before the product gets to the market, because once it gets to the market, a machine takes over, marketing machine, a regulatory machine to promote them. Here's an example of the clinical trial for the hepatitis B vaccines. You don't have to take my word for it. It was the first one on the list. It says in 3 clinical studies, Recambavax HB were administered to 147 healthy infants and children up to 10 years of age who were monitored 5 days after each dose. Section 6.1, if you look at section 6.1 of every package insert, that is where it summarizes the clinical trial. That is the clinical trial relied upon to license the vaccine given to babies on the first day of life. It seems so outrageous, by the way, we FOIA'd for the underlying clinical trial documents. I can confirm it's 5 days. We also have the FDA's summary basis of approval because it seems so unbelievable. If I wanted to make up the most nefarious, craziest thing about vaccines, I wouldn't have thought to say that.
Dr. Plotkin, earlier you testified that there are 2 Hep B vaccines in the market, one by Glaxo, GSK, that's Engerix B, and the other one is by Merck, Recambavax HB, right?
Yes.
This is the product, the manufacturer insert for Recambavax HB, correct?
Yes.
And the clinical trial experience would be found in section 6.1, correct? Correct? Dr. Plotkin?
Yes.
Okay. In section 6.1, when you look at the clinical trials that were done pre-licensure for Recambavax HB, how long does it say that safety was monitored after each dose?
Let's see. Uh, 5 days.
Is 5 days long enough to detect an issue that arises after 5 days?
No.
Is 5 days long enough to detect any neurological disorder that arose from the vaccine after 5 days?
No.
There is no control group, correct?
It does not mention any control group, no.
No. If you turn to section 6.2, under immune system disorders, does it say that there were reports of hypersensitive reactions, including anaphylactoid reactions, bronchospasms, and urticaria having been reported within the first few hours after vaccination?
Yes.
Have there been reports of hypersensitivity syndrome?
Yes, that's what it states.
Does it reports of arthritis?
It is mentioned.
Okay. It also reports autoimmune diseases, including systemic lupus, erythematosus, lupus-like syndrome, vasculitis, and polyarteritis nodosa as well, correct?
Yes, that's what it states.
And also it states that under the nervous system disorders, it states that there have been reports of Guillain-Barré syndrome, correct?
Yes.
As well as multiple sclerosis, exacerbation of multiple sclerosis, myelitis, including transverse myelitis, seizure, febrile seizure, peripheral neuropathy, including Bell's palsy, radiculopathy. Thank you very much. Muscle weakness, hypothesia, and encephalitis, correct?
Correct.
These are events that are reported after vaccination, and as we've just discussed, in order to establish whether it's causal between the vaccine and the condition, you need a randomized, placebo-controlled study. But
Yes.
that was not done for this hepatitis B vaccine before licensure, was it?
No.
Okay. And given that the vaccine now appears on the CDC's recommended list, isn't it true that it would now be considered unethical to conduct such a study today?
It would be, yes, it would be ethically difficult.
Because this is where people finally, I think a lot of people go, all right, okay, clinical trials are so bad, post-licensure are so bad. Why would the regulators do this? We get the pharma companies, they want to make money. Why would these CDC officials, FDA officials, why would they do this? We just talked about who's responsible for vaccine safety. They are. Federal regulators. Why? Because the pharma companies were giving complete immunity effectively. There's some exceptions. And Congress recognized they left a vacuum in that market force. So they made the federal health authorities responsible. Well, let's see what they've been doing. Here's a report by Congress in 2000 of the FDA and CDC's vaccine committee. Here's an excerpt from that report. Quote, and some of you might know it's ACIP and VRBAC. That might sound familiar to some folks. The overwhelming majority of members, both voting members and consultants, have substantial ties to the pharmaceutical industry, end quote. That's a congressional report making that finding, not me. And by the year 2000, most of the vaccines on the childhood schedule came about after 1986, and then through the 90s is when the gold rush happened, when the immunity first came in place. So a lot of these vaccines, now you would think that after this actually really embarrassing, scathing report, which by the way lists Dr. Catherine Edwards in it as well, but only caught like a tiny fraction of her conflicts based on our research. You think they'd clean up their act. No. Here's a report from 2009 by the HHS Inspector General, again finding incredible conflicts between those who serve on the advisory committees in the federal health authorities and pharmaceutical companies. Well, you think after that they'd clean up their act. I'll show you one more video with Dr. Edwards, and this has to do with the Pfizer COVID-19 vaccine, right? So we can get real recent. She sat on the Data Safety Monitoring Board. This was like a 5-member committee. Everybody was relying upon to ensure the safety of the COVID-19 vaccine. Let's see if she had any conflicts with Pfizer.
Isn't it true that you've also been an advisor to Pfizer?
Yes, sir. I have been an advisor to Pfizer, and I've been working very closely with Pfizer, particularly their COVID vaccines, and going over lots of reactions and adverse events. So yes, I am working and being paid by Pfizer for my assessment of vaccine safety.
You're part of the Data Safety Monitoring Board for the
That's
Pfizer
correct.
COVID vaccine. Is that what you meant when you just
That
said
is
that?
correct.
You're one of the only 5 members of that Data Safety Monitoring Board over the Pfizer COVID-19.
Yes, sir, I am.
And that's supposed to be an independent Data Safety Monitoring Board, correct?
It is an independent data safety and monitoring board.
That's the board that all of us in America are hoping on and relying upon is going to independently make sure that safety is properly assessed as the clinical trial for that Pfizer COVID-19 vaccine is ongoing, correct?
That's true, and let me tell you that we have worked very hard to go over this and very hard to do that indeed as comprehensively as we possibly can.
And since it's supposed to be independent, it's critical that the members of that independent Data Safety Monitoring Board are in fact independent of the pharmaceutical company whose product is being evaluated, correct?
That's correct.
But isn't it true that directly before becoming a member of the independent Data Safety Monitoring Board of the Pfizer COVID-19 vaccine, you were an advisor to Pfizer?
Pfizer pays me to evaluate the safety of the vaccines because I'm an expert. So I do get paid to do the work that I've been doing, but I've been doing the work conscientiously and comprehensively.
My question was, before you became a member of the independent Data Safety Monitoring Board for the Pfizer COVID-19 vaccine, isn't it true that you were separately, before you held that independent position, you were an advisor to Pfizer?
Yes, sir, but I think what you're presuming is that because I've been an advisor makes me on their dole or makes me going to say what they want me to say. That is not and has never been a part of my being. I say what I believe based on my expertise.
So you don't think that financial incentives can sway people's judgment at all?
It does not sway my judgment, sir.
Why bother having an independent data safety monitoring board? Why doesn't Pfizer just have some of its employees on it?
Because we are independent.
Meaning folks who were never advisors to Pfizer.
We are independent from Pfizer in this assessment.
I'm sure that I don't know what to say, but I'm sure that every member of the VRBAC and ACIP committee who sat on there and decided that yes, X vaccine should be licensed or they should be on the CDC schedule, who similarly have conflicts, all thought, I'm above that. I'm above that. That's not going to affect my judgment. What's scary about this is it's a deathly serious issue. And what makes it even more troubling is that, you know, the safety and efficacy of products, we can all sit back and say, yeah, I don't know if it's safe or effective. We could do that for drugs and so forth. And we can make our own judgment about whether or not we want to trust these regulators. Except for one product, really, vaccines. That's where they want to take the choice away from you. And that's where, and what do they do? What do they say as the basis to take away that right? One of the main claims they make is that it's right, which makes that claim not only a medical claim, it makes it a legal, civil rights, political claim, because they use it to take away your rights, right? They cry and moan, why are lawyers talking about safety and efficacy? We'll stop taking people's rights based on that claim, and I'll stop coming on these stages. Well, I don't come on these stages often, but yeah, well, you know, a lot of folks would stop, I think, having an issue. It's the mandates that are really a big problem. Okay, moving forward. Here's the FDA website, by the way. That's one of my favorites. It shows, wait, this is the FDA homepage. Does that look like a regulator or does that look like an ad? And what are they advertising? The bivalent vaccine boosters. Question, is that licensed? Oh, it's not licensed. So they're promoting an unlicensed product. I'm sure that in no way will impact their judgment when they're deciding whether to license it. I'm sure that the guy, Dr. Peter Marks, who heads the vaccine division at the FDA, when he's going out and doing all these YouTube videos telling everybody to get this vaccine, will in no way influence his judgment after telling millions of Americans, go get the shot. It's great, go get it. Stick it in your arm, pregnant women, children, everybody, jab it in, go get it. And then when he's sitting there in his office saying, should I license this as safe and effective? Or should I go tell the American people, oops, license.
Components of vaccines, and especially with your education and academic background, you would have had the opportunity to make other choices, perhaps, at least the opportunity to weigh it out and decide if this was the right thing or not. And you've now done a good bit of research and have, in the vaccine community, the autism community, you become a very strong advocate for getting the truth out there. Where has this led you, this journey to discover why does the public not know about this? Why do parents not know about this? Why is it maybe a bad idea that the government wants to mandate that children get vaccinated. So talk about that journey a little bit.
Well, my journey started in 2001. That's the first time that the Institute of Medicine, which is a part of the National Academy of Sciences, that is the first time they convened a meeting, and they specifically convened a meeting regarding thimerosal, the mercury-containing preservative that was in 3 of the series of vaccines that my son received. That's the first time that there was any type of public meeting where parents could participate, parents could send in comments. I was on the West Coast, the meeting was on the East Coast, but I was firing away emails to the National Academy of Sciences. I was following the research at the CDC, which at that point, even though the CDC had not officially published any research on thimerosal, we knew, because of some of the things that were being leaked out, that the CDC had found a relationship between thimerosal-containing vaccines and autism, especially within the first month of life. The CDC was actively working to cover that up with very dubious statistics, and I knew something was dead wrong. And I was, with the internet really starting to grow at that particular point in time, the early 2000s, I was starting to meet other parents, other families, other people that were going through the same nightmare in their own personal lives that my family was going through. And so I became active. In my past research, I had done a lot of statistics. When you clean up a Superfund site and you say it's clean, you have to prove it to some level of certainty. So I had developed an expertise in statistics, and I tried to and I believe was successful in applying that expertise to the epidemiology that the powers that be, the CDC, the National Institutes of Health, the things that and the FDA, the things that they were relying upon in order to somehow proclaim in a very religious fashion that thimerosal was safe. We knew that it was preposterous that anybody would say mercury in any form was safe to inject into an infant's body. We knew that. And so the eyes were on the National Academy of Sciences. The Institute of Medicine did deem that they could not rule out a relationship between thimerosal-containing vaccines and neurodevelopmental disabilities. And then the race was on. The CDC was trying to cover up this relationship. I was actively at that point calling CDC researchers, giving my input on their studies that they were doing in the United States, studies that they were planning to do in Denmark, Italy, the UK. The CDC was so desperate that at that time to find any population of children that would somehow indemnify thimerosal that they were going to Greenland. They were looking at cohorts of individuals with autism in Greenland somehow to use that particular population to say there's no relationship between the thimerosal that you get in the infant schedule in the United States and autism. They were completely desperate. And so I knew at that particular point in time I had to get involved.
Wow, and that led you on quite a journey.
The reason why they were doing that, I had recovered emails via the FOIA.
FOIA meaning Freedom of Information.
FOIA meaning Freedom of Information Act.
So for anybody who might not understand that, the CDC is a government entity.
That's correct.
And we, the citizenry, have rights to get disclosed. Not all information is available to us, but a lot of information is available to us. So you file this request for freedom of information, and if they honor the request, they'll give you certain documents. So what did you find?
I received documents early on from the CDC, and I found that in the background, the chief scientists in vaccine safety were trying to preserve the vaccination program. They had no intent to help children, but everything was focused on, we have to preserve the vaccine program, and we have to keep that going. And there's also...
Why do you think that is, though? Why do you think they seem so hell-bent? These are scientists. Supposedly they're serving the cause of humanity. Why do you think they were hell-bent on preserving the vaccine program as compared to reporting the data as they saw it?
The CDC acts as a vaccine company. They buy $4.6 billion worth of vaccines every year from pharmaceutical companies, and they take those vaccines and they distribute them to the state public health departments.
Literally the CDC purchases over $4 billion worth of vaccines themselves?
That is correct. That's one of the things that
So
Dr.
they're a
Thompson
purchasing
revealed to me.
agent also, not just a research entity, but a purchasing agent.
They are a purchasing agent, and they're extremely conflicted. They did not want vaccination rates to go down, primarily because if vaccination rates went down, they would not be reimbursed for the vaccines that they were buying to be distributed by state public health departments. So it's big business. It's big money. $4.6 billion were on the line, and that's when you see a scientist talking about the nebulous, well, we have to keep the vaccine program going, we can't damage the vaccine program. When you see a CDC scientist saying that, basically what they're saying in the background is we need to get our reimbursement of that $4.6 billion.
So you start submitting your first FOIA requests. What comes back?
The first FOIA requests that I submitted were in 2004, and just to back up, the primary reason I was submitting those requests is because CDC had cut off any scientist-to-scientist contact that I had with Thompson or any of the other scientists in the vaccine division. So my only recourse to get information from CDC was via the FOIA. And I started to submit requests, and one of the first things that came back was a big cheat on a study that had come out of Denmark.
A big cheat?
Cheat.
What does that mean?
It means that they use statistics to lie about the autism incidence in Denmark.
That's an extremely bold statement. So you're asserting it like with full certainty. So why do you say that?
I have full certainty that what they did, somebody got the big idea that autism rates were increasing in Denmark even though they had removed thimerosal from the vaccines in 1992. So therefore, if there was a connection between thimerosal and vaccines in the autism epidemic, then you should have seen numbers go down in Denmark.
Right.
Okay. What they did was they published false data showing a very false increase in the incidence of autism in Denmark. But it came to data that was in 1999, 2000, and 2001, when the oldest kids were actually able to get an autism diagnosis, and there was a steady downward trend. So what CDC did in connection with the Denmark researchers is that they recommended that they remove the last data points, so the only thing that you would see was an upward trend in the autism diagnosis after they removed thimerosal from vaccines. And we know, historically now we know that's the what's called the Madsen study. It came out in 2003 in the Journal Pediatrics, and historically that study has been debunked. But I actually got the emails where they made the decision that they were not going to put the last data points in the study because they indeed showed a downward trend, and that was counter to CDC policy to keep thimerosal in vaccines.
So let me get clear. You've actually seen the emails where they said, we're going to remove certain data points to give a false impression of autism rates so that so people will not draw the correlation between thimerosal, in this particular case, thimerosal and autism.
You have to understand, the CDC never puts that type of verbiage in an email.
Right.
They will never say something like that. But they had a co-author from Denmark who was saying these data sets, these data points are important. We need to include them in the publication. And then the principal investigator, who was at the CDC at the time, said, no, we have to have a discussion and we may have to remove that data. And we know historically, if you go back to the paper, they removed the information that would have shown a downward trend, not an upward trend, but a downward trend after they removed thimerosal in vaccines.
Involvement in the vaccine safety movement is, and how it came to be.
Right. So it's been a long journey. I got involved in the 1990s looking at vaccine safety. It was initially a playground conversation amongst moms. We would attend these preschool meetings, and you'd hear from older moms this murmur of something was going on with the vaccines. And we started to investigate. We started to look things up and read about it. I also was still working, and my job took me to London. So my former husband and I lived in the UK right about the same time the buzz around the MMR vaccine was going on with Dr. Andy Wakefield. So initially, I had questions, and nobody seemed to have answers. I had my first child in 1997, and in 1998, she reacted to her MMR vaccine. She had night screams, back arching. I could not console her for months on end.
Did this start right away, right after her vaccination, or?
Pretty much. At that time, I was still working, and during the day, she would stay with a nanny, and I went off to my work at Price Waterhouse. And so this was something that I saw as rather dramatic, because during the day I was gone. I'd be up 3 or 4 hours with her in the nighttime while she was having these inconsolable night screams, and it was a very traumatic experience for me. I was raising her on my own. I was an executive senior consultant with Price Waterhouse. I had a lovely career going. My then husband was traveling with IBM, and he was gone. So I was really raising her on my own.
And this wasn't just infantile colic, that she didn't have it in the first year of life. It clearly started
about 13 months when she received her MMR vaccine.
So like the same day, a week later? I'm very curious.
There was a cascading effect. I don't think at the time I went, boom, she had that, and boom, she had this problem. It was over time, over a number of weeks. And it went on for several months. And I remember asking my mom, is this normal? This waking up in the middle of the night. She didn't look like she was awake even. It was more like a night terror screaming, they called it. So I took her to our pediatrician down in Florida, who was very open-minded. He was an integrative MD. And he gave me some education around the MMR vaccine. He diagnosed her with allergies, and he did a lot of treatments around things like the egg allergy, which the MMR is cultivated on an egg protein. So the inflammation that started with the MMR affected her throughout the next several years in the form of allergies, asthma, ear infections, and the night screams went away. We did do a lot of allergy elimination. I ripped the rugs out of the house, got the breathing parts bettered.
Did you vaccinate her? Did you further vaccinate her?
I did. I actually was on a delayed schedule. I took her to Children's Hospital in Philadelphia. She had a heart murmur when she was young, and I had a specialist take a look at her. And during that appointment, she said, Mrs. Loughborough, there's a doctor here who would like to speak to you. I'll hold on to your daughter while you can go have a conference with him. And I said, sure, what's it about? And I got kind of nervous because I thought, oh, she must really have a bad heart problem going on. Well, it turned out it had nothing to do with her heart. It was actually, in my opinion, a planned meeting with the then head of pediatrics named Dr. Paul Offit. And he brought me into a examination room. He had a nurse also attend this meeting, and he questioned me rather fervently about why I wasn't on schedule with my vaccines with my daughter. And so I explained to him, I'm concerned. There are changes going on in the vaccine program. I don't understand. I'm not getting clear answers as to why our national program is changing the schedule. And I've read a lot, and it looks like there could be some problems, and my daughter has reacted to the MMR vaccine. He said, well, what makes you say that? Who's telling you that? And I said, well, my pediatrician in Florida. He said, who is your pediatrician? He said, nurse, write that name down. And he said, do you know who I am? And he gets very close to me, and his body language and his voice tone and mannerisms were that of very serious conversation we were having. In the back of my mind, I was thinking, my daughter's in a different room to me. Am I being set up here as this crazy mom because I'm taking a different approach and have concerns about her vaccines? So it was very uncomfortable for me. He asked me what my profession was. When he learned I was a management consultant, he seemed a little more respectful. At the same time, he was calling me a baby killer for delaying my vaccines with my own child who was having problems with them. He was explaining how in Africa, children were dying of infectious diseases, and people like me who were spreading these myths. I said, I'm not spreading any myths, I'm just having a conversation with you. And he said, well, I think you should stay on schedule. I said, well, I'll take your advisement and I'll go home and talk to my husband and we'll make our decisions and thank you. And that was about the end of the meeting. It was a little rough. There was...
Thank you very much. I'm so happy to see all of you out here today finally telling the truth to this Congress, which needs to hear the truth for the first time. The government scientists are acknowledging that even tiny infinitesimal amounts of mercury, parts per billion, will cause profound neurological injury in children. And I was working on these issues, and mothers started coming up to me and said, you know, the biggest exposure is not coming from power plants or old mining claims, as you might think. It's coming from our own vaccines. And they asked me to work on it and just to look into it. And they were not hysterical people. They were scientists, they were doctors, they were psychiatrists, they were pharmacists, they were people who had their feet on the ground, they had attended the conferences, they had read the scientific literature, they had calmly and deliberately gone through this, and they had reached a conclusion. And the conclusion was that the vaccines were destroying the health, were making the sickest generation of American children in the history of our country. And I started looking into it, and somebody provided me with the Simpson-Wood memo, which I then published in Rolling Stone. And Simpson-Wood was the transcripts of a secret meeting that was held between CDC and 75 representatives of the vaccine industry, in which they reviewed a report that CDC had ordered, the Verstraeten study, of the 100,000 children in the United States Vaccine Safety Database. And when they looked at it themselves, they said, it is impossible, this is a quote, to massage this data to make the signal go away. There is no denying that there is a connection between autism and thimerosal and the vaccines. And they said, and this is what they said, I didn't say this. This is what their own scientists and their own conclusion of the best doctors, the top people at CDC, the top people at the pharmaceutical industry. And you know, when they had this meeting, they had it not in Atlanta, which was the headquarters of the CDC, but in Simpson-Wood at a private conference center, because they believed that that would make them able to insulate themselves from requests under the Freedom of Information Law, and they would not have to disclose the transcripts of these meetings to the public. Somebody transcribed the meetings, and we were able to get a hold of it. But you have them talking about the Verstraeten study and saying there's a clear link, not just with autism, but with a whole range of neurological disorders, speech delay, language delay, all kinds of learning disorders, ADD, hyperactivity disorder, and the injection of these vaccines. And they could tell because, as you know, the vaccine protocols were dramatically increased. When I was a little boy, we only got 3 vaccines. But my children, 5 of my 6 children, got 22 vaccines. Beginning in 1989, that's the thimerosal generation. That's the vaccine generation. And it's the sickest generation in the history of this country. And I looked at these, I read, and I was astonished. Because I have worked on environmental issues for 25 years. And I know what captive agency phenomena is. It's the dynamic by which the regulatory agencies become captured by the industries they're supposed to regulate. And there's all kinds of mechanisms that encourage that or provoke that or promote that to happen. But I was shocked because I know many of these people in CDC. And I know the people in the FDA. And I know that when they entered those agencies, they entered it with a good heart, intending to do the right thing. But something had corrupted them. They got sucked into a vortex because they made decisions that were wrong, and then instead of admitting it to the public, they covered it up. to protect themselves.
What happened, though, was Porter, even though he'd had the pertussis reaction, his neurologist said he should get the rest of his vaccines. And so at 15 months, he got the rest, not the pertussis, and promptly wound up in the ICU, had such a horrible regression. And it was funny, our neurologist, who's anything but a fringe player, said, I think Porter's the first kid I'm going to say you should have no vaccines, and I think you need to be very wary about vaccinating subsequent kids, which I thought was really interesting. You know, my personal bias is like most medications, we're likely going to find there's a genetic piece and an environmental piece. We find that with everything. So, you know, some of us can't drink alcohol, some people can't have fish, some people, so on and so forth. And likely there's, and I think we're seeing that in science, some differences. The problem is it's a bit of a crapshoot. We don't know what boat you land in. We know in our family because we have a child who's in there in his helmet and diapers at age 20. So with the next two, we didn't vaccinate when they were little. When the middle one got to be a teenager, he got some of the basic ones, tetanus, he's gotten polio, and I don't know another one. But when they were little, they didn't get them, and that was at our doctor's suggestion.
So think how many, I mean, I know you can't, it's not your job to think about other people because you've got your hands full, but I'm sure you do look at other parents and wonder and would like to tell them. There's so many people whose children have been vaccine damaged, but you know the doctors deny it because they can't believe it themselves, really. I think that's probably more common than them lying. And then they go on to vaccinate the next kid, and I've known families with 2 or 3 kids with either autism or things on, you know, their children are on the spectrum and all regressed post-vaccination. So I feel that, and you might agree with me, but I feel that this lack of wanting to admit the reality is actually causing way more damage because we probably could be a lot more selective in what we're doing in terms of vaccinating children and cause less damage if we were willing to look at the real risks.
Yeah, I mean, if vaccines don't have any side effects, it's the only big medication we've created that don't. You know, I mean, every medication has a potential side effect. So to say just globally, and this is where my science side comes out, no problems, that's as ridiculous as saying all problems. I mean, that kind of black and white dichotomous thinking is just.
So what are your thoughts on Blue Chew, Kayla?
I love that stuff.
Sometimes you got to make
stretches credibility for me. So clearly, you know, like any medication and any person with any kind of issue, there's going to be some that don't do as well. Certainly, you know, I'm not a pediatrician, that's not my specialty, but I can tell you in our family it became apparent there was an issue with Porter, and we had the support of doctors saying, you know, watch it with the others. I think at the very least people need to get educated. You know, even in different countries in the world, we have different cultural norms around vaccines. If you look at, for instance, countries in Scandinavia, they use far fewer vaccines. They do them much later. You know, the brain development isn't fully happening for several years.
21, 22,
well, 21
23.
in terms of something like the neocortex being developed, but in terms of really aggressive development happening, little children are still in the throes of that. And so places like Scandinavia will delay giving all of the vaccines. They give fewer. They do it on a different kind of schedule, a staggered schedule. So, you know, there's lots of ways to go about this. There's lots of different things that people are doing. There's additives in some vaccines. Thimerosal has been a big hot button because it's heavily, it has a lot of mercury in it. It's mainly mercury. That's in many vaccines still. It's still in the flu shot, for instance, and yet there's mercury-free versions. So you can get into this deeply and really study it and figure out what's right for your family. You can do it in more of a light way to say, I'm just going to get educated on things like, you know, getting a shot that doesn't have mercury in it.
Well, that brings up the issue of the fact that there's aluminum, another heavy metal, that is in many of the vaccinations as the adjuvant. Not a preservative like the thimerosal is, but as an adjuvant. And I don't know if you're aware of any of the neuro studies on aluminum, but
I have read some of that, and it, you know, I mean, it really gets to a complicated issue around how you want to approach your health.
It really does. Who do you think should be making the decision on how our children and ourselves are vaccinated or how we choose to boost our immunity and live our lives. I mean, do you think that really it should be mandated at the state or government level in terms of, even for adults now, I mean, this is where we're headed. It's starting with healthcare workers. I mean, even if you're a janitor going in and out of a hospital, you are mandated now to get, in most places, to get an annual flu vaccine. Many states have now, not many, but there's a handful of states and more are joining, mandating annual influenza vaccination for preschoolers and all the way through school years. And I can add that one of the states, the first state to introduce that is New Jersey, and they, along with Utah, have the highest rates of autism. So it's 1 in 27 boys. So my question to you really is, as a parent and as a person with individual rights, who do you think should be dictating how you handle your health care?
I am very clearly in the camp that a person, an informed person, should be making that decision. We're very fortunate to live in Minnesota that lets you make that decision. So, for instance, my other kids when they were little, were not vaccinated, and the schools would always ask us about that. But you can have an exemption, and that is something that's allowed here. You know, I would hope that everybody gets educated to whatever degree they can, and makes a decision for themselves.
Yeah, exemptions are on their way out. That's part of the problem. But I appreciate the sentiment. I agree with you. I mean, I was hoping that's what you would say, but everyone's got a different view on this. It's such a hot topic that a lot of emotions run high when you talk about vaccination. And one more question would be regarding that, because your other two weren't vaccinated, or at least not fully vaccinated. Did you have families or parents saying that they didn't want their children playing with your children because they were worried that their children would become sick?
Yes, we definitely did have that, and I've heard people say that even recently in relation to them. It's funny, just assuming I had that happen recently, that someone said, I don't want those kids around my kids. And at this point, the older kids are vaccinated, so that's kind of a silly thing to say. But it does speak to just kind of a hysterical reaction to it and a knee-jerk reaction to it, that there's something bad. And by virtue of saying that, if you extend that logic, then you can't let your kid be out in public, because in places like Sweden, there's a lot of things they aren't vaccinating for, and those kids are coming over here. So if you're that concerned, you wouldn't want to let your kid out of the house. I mean, the problem with the globalization of medicine is 1 billion people cross the borders every year, and there's different standards on how we're vaccinated and everything else. So I think it's getting clear what's right for you, what's right for keeping your health in the place you want it and for your kids, and then going from there. But yes, we certainly have had those kind of reactions.
And just to add to what you said, adults aren't vaccinated here on average, and the antibodies last at best 10 years for all those childhood vaccines. So you'd have to keep your children away from adults in the public sphere. So it also is it seems kind of crazy to me, but I know I understand the science a little more than than a lay parent who's not trained in medicine or science. But I know that can be also difficult, which, so you already have a child that's got special needs, and then you have possibly parents saying, oh, I don't want my children playing with your children until they catch up to the schedule. And it sounds like your children got a few vaccinations, but were never caught up to the full schedule.
Not to the full schedule, and that was, again, because our neurologist was very clear that wasn't a good idea after watching what happened over time with Porter. That is something people will say.
You're in science, you've got an academic degree, and you certainly have experienced a failure of the system firsthand. So my question to you would be, do you have any suggestions on how the system can improve?
Yeah, again, because of a background in science, I actually believe in vaccines. Vaccines are something that I would be in support of. To me, it's sort of like when we get into the argument about, are you pro-life or pro-choice? There's a big middle ground, which is unwanted pregnancy prevention. So the middle ground, as far as I'm concerned, is let's concentrate on something that's neutral to start with, which is vaccine safety. At the very least, people getting educated about their health, the vaccines being made as safe as possible. And then when and if the horrible, unfortunate thing happens, that kids have a side effect, kids die, whatever might happen as a result of our public good, which is having everybody mandated to take these medications, then let's take care of those kids. To turn those children and their families into pariahs when they are the casualties of a system that's supporting the public good is what was totally insulting to me. You know, I can really understand cause and effect. I can understand unintended consequences, and even that my own son had this reaction. What was reprehensible to me was then going through the process of being humiliated, going through the process of being labeled hysterical, labeled all the things you're labeled when you say, my child's had a reaction to this. So I would like to make sure vaccines are as safe as possible. I'd like to look at the vaccine compensation program and really start shoring it up to be what it was intended to be, which is neutral, compassionate, swift justice for kids that end up having problems as a result of following the schedule. And I really would hope that people step up and get as educated as possible to be able to make good choices.
Do you think that it's possible to have as safe and as effective vaccines as we possibly can if the manufacturers don't have any liability whatsoever?
No, I think that is a problem with it. I understand in sort of a logical sense how that got set up, that they wanted vaccine makers to make these for the public good and they wouldn't if there was liability. The unintended consequence of that is that they don't have any skin in the game. You know, I'd love to run my business and say all the profits I get to keep, and if I make a mistake or something goes wrong or there's expenses related, I don't have to pay those. I mean, that's a great deal. But it's sure not going to drive me to try to fix things that are problems because it doesn't affect the bottom line. And don't be confused. I mean, the vaccine makers...
Every day, people tell us about the excruciating dental pain they deal with. They tell us about the shame that keeps...
And the pharmaceuticals are businesses. That's not evil to say they're businesses. Business is a neutral word. But they are in the game to make money. And so they will respond to things. If there's a problem that causes them to pay a lot of money, they're going to respond to that and change. The way the system is set up now, though, I don't see why they would be very motivated to do that.
Yeah, they have no liability. Can you tell me what it feels like to have this happen to you personally?
You know, there's a lot of ways to answer that. What it felt like at the time is different than what it feels like now. What it felt like at the time was as if someone had unzipped the ground under my feet and I just dropped in. And it was dark and I was falling and I was upside down and nothing made sense. It was devastating just to have a child that I loved and was attached to completely have everything stripped away that I knew about him, his personality, his cognitive ability. And that's one piece. Grief, if you can move through it, is clean and honest and okay to go through. And we got through that piece. I think what has been the hardest part is what's happened subsequently. I feel like the most pain that's happened has been relating to trying to get Porter taken care of. Trying to get the respect that if we are going to be a casualty in this whole process, of which there will be some, I don't feel singled out, I don't feel why me, or stuff happens in life. I understand that. But if it does happen, you know, take care of the people that have been injured. And that is the part that's been really pretty devastating, to try to understand, you know, why people are treated this way who've had the injury, who've gone through this process. That's probably been the hardest.
And I hope that you feel empowered to research vaccines, to research all of the package inserts for any vaccines that your physician, your pediatrician recommends for your child, because you probably are not going to get that informed consent process at the clinic. So it really is up to parents and caregivers to be doing this research, to read the package inserts for all of the vaccines is a really good first place to start. And just really thank you so much for watching this video. And it means a lot to me because I have had many friends since I've been studying vaccines for a while now, but I did that secretly. And so it was kind of a big deal for me to start making these videos and kind of exposing this. And I've had friends that don't want to be friends with me anymore, basically said I have bad morals. I got kicked out of a group I've been in for 12 years because people didn't want to even be in the same room with me anymore, looked at me like I was a piece of garbage. Um, I've had friends that have just reached out to me saying they have no idea how I could possibly, be part of this anti-vaccine movement, which again, it's not an anti-vax movement, it's vaccine safety movement. And I've had friends who have just wanted me to know that they totally disagree with me, um, which is interesting, but then just say they don't want to talk about it. And I've also had a lot of friends who have confided in me that they maybe didn't vaccinate their kids, or they did a delayed schedule, or, I had a few people reach out to me that their children actually had seizures after the vaccines. Um, I've had a lot of really interesting feedback. And, for me, it's sort of like I've always had a lot of friends. I've always had a really big network of people in my life. And it's okay, if there are people who don't want to hear about the work that I'm doing with the vaccine safety movement. If you want to be nasty to me, condescending, if you want to try to educate me, um, and you're an accountant and don't know anything about vaccines, but you want to scold me and reprimand me, well, those are probably good signs to me, right? That those types of relationships probably aren't unconditional loving relationships. Those are conditional relationships where you really have to be a certain way, act a certain way, to really be valued in that relationship. So it's helpful because I know where I stand in these friendships and these relationships based on, not saying people have to agree with me, but if people are respectful and kind to me, express interest, curiosity. I've had a lot of people who have reached out to me saying, like, geez, this wasn't even on my radar, but I know you. I know that if you say you've been studying this and you've researched it and you're talking publicly about it, um, I want to hear more. I want to understand where you're coming from. I want to understand, what you're basing this on. And so I've had just really great discussions and appreciate that. And for the people that maybe don't want to hear anything I have to say in my life, or have cut me out, or have made it very clear that they have no interest, that's fine. That's totally fine. I, as a social worker, understand that people act a certain way when their worldview is challenged. I get that. I understand that. So thank you so much again, and just thank you.